Hi, this is Angela with Angela's Nurse Toolbox. Last week I discussed how we use a Flexi Seal, okay, for students and educators. This is like a rectal tube. This part would go in your patient's rectum. We would inflate it, and it helps patients that have the watery diarrhea. They might have C. diff, drain that fecal matter so it doesn't cause skin breakdown. It helps reduce infection with them. They're not sitting, they're not constantly incontinent of it. It just drains it away. So to give medicines, this is your medication port. This is your purple port. This one, it tells you irrigation and medications only right here through it. It even labels it for you. So it's this tube that goes along the top of it into the outer part and goes right into the rectum. So it's not going to be traveling in with the part that's draining the fecal matter. So what you would do, you would have gloves on. You would unscrew this part, purple part. We would take our syringe with our medicine. This screws in, and we would go ahead and start pushing that medicine, and you can see it kind of moving just on that line, and it's going straight into the rectum. So if you look at this part, it's only through this little part that it's coming out. Okay, I'm just kind of showing you. So it's not through the part where all that stool would be coming through. So once I would push that medicine, there's a clamp that they give you. We would clamp it forever how long for that medicine to work. A lot of times, yeah, I got a lot of medicine dripping out. That medicine that we might give might be lactulose to decrease ammonia levels. It could be like a steroid enema. Maybe the patient has severe colitis and inflammation and they need them to retain it into that rectal area. This is not some place that we're going to push like we do with our NG tube and PEG tube meds, where we crush all their meds and give it through a rectal tube. So usually it is for just the rectal area, and it would be like lactulose or steroid enema. We would give the medicine. We could irrigate it after we flush that medicine to make sure the medicine's not still in this tube, that it's all into the patient. And once we finish for the prescribed time, then we can let it come out and then flush it again. Okay, so that's how we use a rectal tube and give medications. If you like my videos, follow